What's going on, everyone? Happy Saturday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Saturday edition of the Pandemic Update for Saturday, January 27th, 2024. If you're new to my channel, this is where we do the daily pandemic update on not just COVID, but any virus that could be a threat to you. If you want to keep yourself informed and keep your family safe, then hit that subscribe button down below and give this video a thumbs up at the end if you have learned anything. Alright, we do have several news stories to talk about today. Then we are going to go over some polls that I have conducted recently. One, which I conducted the other day, and another, which I just started about a half hour ago, and I can't believe how many responses that one has already gotten. First off today, remember how we were talking about measles outbreaks in Philadelphia? Not just Philadelphia. South Jersey had a case, there was a case in Delaware, and down in Virginia. Well, now Philadelphia is starting something else, which actually probably didn't start in Philadelphia. It's something we've been seeing a lot of lately, but let's explain. Philadelphia Health Department warning about possible hepatitis A exposure at ShopRite. And I hate to admit it, I'm going to give you the address and everything. This ShopRite is my local ShopRite. It's not far from me, so yeah, not a good thing. The individual worked while infected at the ShopRite located at 6301 Oxford Avenue, January 4th to January 21st. So, if you did buy any meats at that ShopRite, maybe you're from Philadelphia, you happen to go in there, you want to make sure you get a hepatitis A vaccine, and they are going to have a hepatitis A vaccine clinic. I believe it already happened today. It was from 8 a.m. to noon today. But if you can secure a hepatitis A vaccine, by all means do so if you were in contact with that area. If you recall, there was also a hepatitis A case, and it shows it here on the news site, that a worker at Olive Garden in Deptford, New Jersey had a hepatitis A case and exposure just about a few weeks ago. So it's something we're continuing to monitor. Can't give you any wastewater site for Philadelphia County that would show hepatitis in the wastewater, but we can come close. We can take a look at Chester County, Pennsylvania, and I have that set up here. And you can see here, hepatitis A in Chester County, Pennsylvania, there were some detections of it back last year and just recently, January 23rd. So that's telling us in Southeast PA, hepatitis A is in circulation. And if you ever watch when we do the wastewater videos on Sunday, or when we add in a few wastewater sites, in the regular pandemic updates, you do notice hepatitis A does constantly show up in wastewater in various different wastewater sites around the country. So it's out there more than we know about. It's not always easy to get tested for, and, well, there happens to be a case in Philadelphia, in Northeast Philadelphia, right now because someone was at that ShopRite, which is a grocery store. Alright, taking a look here at this. Cambodia reports human case of H5N1 bird flu. The 3-year-old boy is in critical condition. That is not a good thing. Christine Aguilera cancels her Las Vegas residency after just 2 shows due to health issues. So she only did 2 shows, and already she has to cancel her residency. Alright, moving on to this now, over in Queensland. One Queenslander a day dying with COVID in the hospital. Worried doctors and a right to information request have revealed one Queenslander a day is dying after contracting COVID in the hospital. I mean, it's ridiculous. If all medical staff would just wear a mask in the hospital, we could reduce in-hospital transmission. We could reduce it even further if they had HEPA A air purifiers running in these hospitals. It's totally ridiculous. Alright, we're going to take a left turn now. Let's take a look at a poll that I conducted the other day. This is somewhat pandemic related. Actually, no, it is very pandemic related, and it has to do with sick time. Now, it did not get a lot of votes. I started at a late time of night. There's many different reasons. That's fine. I don't care how many votes it got. The point was, I wanted to see how many people, if you're employed or you work for an employer, how many people are getting paid sick time. The poll is, if you work, do you get paid sick time? 71.4% said yes. 28.6% say no. And that is concerning to me. I think if you work for an employer, if you're not an independent contractor, me, I'm an independent contractor. I work for several different gig apps. I do these media videos. I'm a freelance. I work for myself. I'm independent. That's the point. At the beginning of the pandemic, Uber, on the other hand, was offering, if you tested positive for COVID, you could get like a week's worth of pay. It wasn't equivalent to what you made, or maybe it was less, maybe it was more, don't know. You could, they would compensate you and give you X amount of dollars for that week. Then, after a certain amount of time, that ended. I don't know if Lyft did the same thing, but I feel if you're working for an employer, you're a paid employee for the duration of the time that you could transmit or are infectious with a disease such as COVID, you should be compensated for it. Back in the day, I worked for an employer. I worked for Rite Aid. There was no sick pay. I recall a time where I got sick. I was pretty sick, and I took off the first day, had to go to work the next day. We were able to find coverage for the day after that, so I could take off again. And mind you, the days I was off, I did not get paid for it. I may have had one sick day. I think that was about it. The point is, you should be compensated. If you have to call out of work, you should have paid sick time for however many days you are sick. And in the case of being positive for COVID, you should be allowed to be absent until you test negative, and that goes by a case-by-case basis for each individual person. Some people, with the 5-day rule, it works. You do test negative. For a lot of people, you stay positive for 7 days, 10 days, 14 days. We saw a rare case of someone saying 30 days recently. I mean, it happens. It happens for long periods of time. And if you get sick while on the job or wherever the case may be, if you get sick, you should have paid sick time. You should have the right to it. All right, moving on to this next poll, which I literally just conducted. We're going to refresh this because, wow, I literally just conducted this at 1:20 p.m. It is now 1:48 p.m. Already it has 246 votes in. I think this is going to go well into the thousands. Poll: have you gotten sick during the winter surge of viruses? 24.8% say yes in this case. 75.2% say no. Now, I should have clarified a little bit. I should have put, if you put yes or no, were you wearing a mask? I'm curious. Did you get sick while you were still wearing a mask? In rare cases, it does happen. Because remember, if you walk into a place, a crowded place, you're the only one wearing a mask. One-way masking is not always effective if you're wearing a low-quality mask. If you're wearing a high-quality mask, maybe you'll fare out better. In most cases, you do. Let's read some of these comments. Fitz ENG said, no, but I'm asymptomatic for COVID, so who really knows? Yeah, that is really a problem, being asymptomatic for COVID. Crimson McDonald said, my kid brought home a cold, first illness in half a decade. Thankful it is minimally annoying cold and not COVID. Daily testing for 5 days, that is important. You really need to keep testing, and I keep saying to myself, I need to do a video on this. There are a lot of people out there that do testing. I mean, just test once and then say, well, it's negative for COVID. It can't be COVID. And then they go out and think, okay, well, I'm fine. No, there's a big problem with testing. It's a big problem where tests are not detecting the tests or detecting the cases. Then they go out, think they're fine. Then someone else gets sick. They take a test, but they end up positive. Yeah, it's because you actually had COVID. And with these newer variants, it's not always being detected by testing. I think we're going to actually do a piece on this in the coming days, and I'm going to probably do a poll on that as well, leading up to that piece that we're going to do. It'll maybe be sometime next week or next weekend. All right, let's take another left turn. Take a look at something we have not taken a look at in a very long time, and this is the website called Our World in Data. And what we want to take a look at here is we want to take a look at the number of patients in the hospital, and this is somewhat updated. January 24th. Okay, that's not too bad. You can see, United States, the numbers are dropping. But when we take a look at this chart here, you can see Japan. And we mentioned Japan last week. Japan is seeing a rise at this time for the number of people in hospital for COVID. Let's see, we can actually get right down to their actual number, which is at 21,446. So you can see that has been steadily rising since November, and then it started to undergo a rapid rise as well. And then we can see here England. is starting to see the number of people in the hospital go up as well. 2,775 people. Canada has 4,403 people in the hospital. Sweden, 1,292. Australia, 1,523. Netherlands, 626. Italy has 6,964 people in the hospital. And anywhere that we want to take that? No. So you get the idea here. There are some countries that are starting to rise. Japan, which that's kind of common that they would be delayed after the U.S. with a surge. But what we are seeing once again with England, the rise there, that is concerning because as we know, England and the UK often is a predictor of what could happen in the United States. There have been some cases where that does not happen. Only time will tell. We'll have to see if it ends up happening this go around. All right, let's take a look at what is going on with today's air quality data, and you will see a mixed bag of things. There is a storm system in the south. There's another storm system in the Pacific Northwest. But with that storm system in the south, not all that bad. Still, the Great Lakes through the Northeast, some minor air quality issues. The worst area is on the West Coast. And if you're up in Canada, Central Canada, Alberta, British Columbia, Western Canada, you do have some air quality issues at this time, and that is something to be concerned of. If you want to learn more about what's going on with the climate, weather, air quality issues, and the weather forecast, I do have another channel at Climate Data Report. You'll be able to click on the link down below. Check that out and subscribe to that channel if you're interested in that type of content. All right, taking a look at Walgreens this week, the positivity rate is 28.7%. That's a difference of up 1.2% this week. Let's take a look at some more data, shall we? We can see here deaths continue to rise in several states, some of the Northeast states, some of the Southeast states. Not much of a rise ongoing, though, in the southern states at this time. You can see here, Texas is actually down a little bit, but I'm looking at Washington here, and I'm seeing percent change from prior week. Wow, Washington State, it says 23.3%. Absolute difference is 0.7%. California, however, is dropping at this time. Oregon, you're not available, but hey, we will have some wastewater data for you tomorrow. Taking a look here at what's going on with influenza, it is still growing in Vermont and Oklahoma, and likely growing in California, and the rest of the country is either stable, uncertain, likely declining, or declining, and COVID is now either uncertain, stable, likely declining, or declining across the entire country. That is some fantastic news at this time. In the hospital, 26,607. Yes, I know that's a different number than what you saw on Our World in Data. JN.1 leads the way at 85.7%, and in second place is HV.1 at 5.3%. Philadelphia yesterday had 739 EMS incidents. That's good. That's a lower number than the previous day. Live looking at the Philadelphia suburbs, Montgomery County. Not a lot of calls right now. It's actually quiet. Only 9 calls. We do see respiratory emergency, general weakness, cardiac emergency, seizures, general weakness. We see some things going on, but again, not all that busy. And there are some calls in Chester County right now. I'm seeing not 1 but 2 strokes, respiratory difficulty, seizures, heart problems, another respiratory difficulty. Again, it's not always the volume of calls. It's the type of calls. In this case, I would say it's the type of calls. Let's see what's going on in New Jersey right now. And I do have to refresh this. And we'll see how many hospitals report today. 64 out of 70. And, ooh, I'm a little bit concerned here. Let's zoom this in. Yeah, this is a little bit concerning. So it's only 64 out of 70 hospitals. 6 hospitals did not report. And here we are back above 1,000 again, 1,005. Now on the chart, it does show dropping, but perhaps maybe they did a correction. New Jersey is infamous for doing corrections. But in this case, they did a correction with 6 hospitals not reporting, and it went back over 1,000. Wasn't expecting that today. On a ventilator, 50 people on a ventilator. In the ICU, 139. And there are 164 discharges in the last 24 hours. That's quite a few discharges. Taking a look at New York State, let's refresh this just to make sure there was not an update today. No, there wasn't. It's Saturday. 3,714 people tested positive in the last 24 hours. Well, actually, leading up to Friday, there were 3,714 cases, and hospitalizations as of yesterday were 2,408. All right, let's take a look at a state that we have not taken a look at in a long time. I don't think we've ever looked at their dashboard before. This is the state of Arkansas. All right, in Arkansas, cases they currently have, let's see here, it should come up. They currently have 4,132 cases so far this year. Or no, 4,312 cases, excuse me. And let's click on their weekly update. Now, this is a little bit behind. So those numbers were so far in 2024, but I don't think this is updated within the last several weeks. We can see here, yeah, it has not updated cases. Here it says by date. On the 17th, they had 360 cases reported, and on the most weekly update from previous 7 days was 1,683. New COVID hospitalizations was 152, and in the previous 7 days leading up to that date, they had just one death, which, my friends, that is not terrible that they only had one death. But in the month of December of 2023, their pandemic total here for cases was 8,950. Let's see what happens next. And yeah, so we got an update here from Arkansas. That is a good thing. And we can see deaths by age. The majority of their deaths are 65 and older, but hey, they do have some deaths, though be it in small numbers, in younger people as well. Alrighty, folks, that does it for today's pandemic update. We'll have another pandemic update tomorrow where we'll do some news, and then we will take a look at what is going on in wastewater. If you learned anything, give this video a thumbs up. Do you have a comment about sick pay? Leave that down below, because I'm really curious. I want to know what you think about that. Should everyone who works for an employer be entitled to get sick pay? That's my question for you today. If you want to see more content like this, subscribe to my channel down below. Share this with anyone who needs to see it. And I will see you all again next time. Until I see you again next time, stay safe, everyone, and have a fantastic Saturday afternoon. Thanks for watching.